What is dance movement therapy? So according to American Dance Therapy Association, dance movement therapy, or I might just refer it to DMT, it's a psychotherapeutic use of movement to further the emotional, cognitive, physical, and social integration of an individual. Before we go on, let me clarify. Movement, it could be as obvious as jumping, bouncing around, dancing, running around, but also like breathing, the heartbeat, or using your imagination to move. That's all part of movement too. Therefore, we always say that, even with kids who have limited mobility, they can actually participate in our sessions and benefit from it too. And because movement is our innate way of communication, so it kind of transcends the limit of language, the limit of age, gender, and cultural differences. Both movement and emotions are governed by the right side of the brain, as you guys probably already know. So it's different than words. Words is governed on the other side. So it's actually a lot easier to connect and tap into emotions with movement than using words to express it. And so this is an example. When you feel stress, can you recall how your body might do when you're stressed? Like what your posture might be like? Comparing to tense. Might be tense. Sometimes people might be kind of slouching a little. Comparing to when you're excited, you just kind of yeah, it's cool, bouncing around a little. And it's not something that you tell your body to do. You didn't say, okay, let's slap your body now. It's just you feel a certain way and your body immediately, automatically somehow behave a certain way. And that's an example to how the body and the mind is kind of connected, even sometimes without we telling them to. So as a dance movement therapist, we're trained to look at one's movement pattern and help them to find the meaning of the movement in that moment. We believe that the more versatile one's movement is, they're actually more flexible and have more coping skills and adaptive to challenges. When we meet a patient, instead of telling them, okay, I want you to do a set of specific tasks, we actually go in and pick up their movement and follow their lead. We sometimes use music props, sometimes just our body, just voice, and we assess their movement preferences. We look at the rhythm of their moving. They normally moving in the horizontal plane, or they normally moving in vertical. They're very assertive, or they moving in more like sagittal plane. And we use those, and we try to expand their movement repertoire, I call it, through creative, interactive, fun way, in order to help them adjust and cope with being hospitalized and the illnesses. Through movement, we help patients to relax, to express feelings like anger, frustration, loneliness, and also to reach the developmental milestones. Dance movement therapy session can look very different depending on treatment goals and the patient and the therapist themselves. It can range from 15 minutes all the way to an hour and a half, or sometimes, again, with props or not, music or not, sometimes just singing or voice. The range of patients that we serve are also very wide, from doing sensory play with infants to doing relaxation or focusing more on emotional challenges with teenagers and adults.